my name is Emily, and today I'm going to be talking to you about my favorite part of the human brain, the ventromedial prefrontal cortex. So, just so you can understand a little bit more about this and many other parts of the brain, I'm going to just do a little bit of explaining about why this part of the brain has the name that it does. So, you probably know that the prefrontal cortex is the portion of the brain located at the very front of the frontal lobe, so I don't really need to elaborate anymore on that part of the name. So, since this is the ventromedial prefrontal cortex, we can break the qualifying part of the name down a little bit more. Ventral means on the underside of something, so you can draw the conclusion from this name that this portion of the brain is on the underside of the prefrontal cortex. Additionally, medial means toward the middle, so we know from this that it is also toward the middle of the prefrontal cortex. So the ventromedial prefrontal cortex is toward the underside of the prefrontal cortex and toward the middle of the prefrontal cortex. Okay, so keep in mind that this part of the brain can also be referred to as the VMPFC, so just to save a little bit of time and so I don't bore you, I'm probably going to refer to this part of the brain as the VMPFC. So, the primary implicated function of the VMPFC is processing of risk and fear. It also plays a role in the inhibition of emotional responses and in the process of decision making. Research has suggested that neural networks in the VMPFC are developing very fast during adolescence and young adulthood, supporting emotion regulation through the amygdala, which is the portion of the brain very heavily involved in processing emotions. Studies of patients who have suffered damage to this area of the brain demonstrate inability to observe social conventions and inability to decide on matters that pertain to their own lives. They have shown the ability to make moral judgments without any issues or error, but only in hypothetical situations, nothing that pertains to their lives directly. Damage has also been linked with deficits in detecting irony, sarcasm, and deception. So, patients who have suffered damage to their ventromedial prefrontal cortex have a hard time detecting these things when presented to them. Okay, so we're going to switch gears to emotion. The VMPFC plays a role in emotional responsivity and the ability to show compassion, shame, and guilt, basically all the emotions closely related to social and moral values. There has been evidence to suggest that it plays a role in frustration and anger tolerance as well. So, in short, if your VMPFC is damaged, you'll probably become a whole lot more gullible and irritable and a whole lot less patient and empathetic. And you'd probably get along with a lot of my relatives. Okay, moving on. One pretty notable theory of this portion of the brain is the somatic marker hypothesis. According to this hypothesis, the VMPFC has a central role in adapting somatic markers, including emotional associations or associations between mental objects and deep emotional feedback for use in decision making. This hypothesis also suggests that the VMPFC plays a role in moderating emotions and reactions because it marks experiences as positive or negative and generates a reaction accordingly. Keep in mind that this is just a theory, and critics of it conclude that there is a need for more empirical data for support. The biggest thing to note about the VMPFC is that it houses some of the most complex and mature functions of the human brain, the things that make us human and so wildly capable of expressing and detecting emotion. Thank you for watching. I hope you learned something, and I hope it wasn't too thick. I know some of these theories and some of these things are a little hard to follow, but I hope this was helpful. Thank you.